Hello everyone, this video is on diets in various diseases. It's all about how different diseases necessitate dietary modifications for effective management. Everyone enjoys eating anything they desire, without any limitations. However, people who already have certain chronic conditions or are at risk of getting them must be cautious and adhere to dietary restrictions if they are to stay healthy. This video discusses 5 of such conditions. They are diabetes mellitus, hypertension, coronary heart disease, dyslipidemia or commonly known as high cholesterol, and cancers or malignancies. Why do certain diseases necessitate dietary modifications? As you learned in the previous videos, various nutrients play important functions in our bodies. They are therefore crucial for our survival. However, in certain disease conditions, we have to control or limit their consumption for better health. For example, as you know, insulin is the hormone that converts excess glucose produced after your meals into glycogen and stores it in the liver. Diabetes develops when our pancreas produces less insulin or when our body develops resistance to insulin. When the availability of insulin is restricted, conversion of glucose to glycogen is affected and glucose accumulates in the blood. This excess glucose freely circulates in our blood and enters the organs. This high levels of glucose in blood and organs adversely affect their functions. Therefore, in order to manage diabetes, we must give the body more insulin and restrict the intake of sugar and sugar-producing food. Similarly, in order to properly manage many diseases, dietary modifications and restrictions are necessary. By using optimal nutrition therapy in conjunction with the right treatment, people with a range of illnesses and disorders can enhance their health and quality of life. Dietary management is just as important as medical care for many disorders, such as diabetes, hypertension, heart disease, dyslipidemia, and malignancies. So, out of these, let's start the discussion on diabetes, one of the commonest of all chronic diseases. The objective of dietary modifications in diabetes is to lower the risk that diet-related factors exert in the development of diabetes and its complications. The recommended diet for diabetic patients is best explained by the food plate method shown here. Our meals typically consist of cereal-based items like rice or bread, which are starchy foods, fish, meat, or egg, which are protein-rich foods, and vegetables. The first rule for diabetics is that, fill half the plate with non-starchy vegetables such as green leaves, lettuce, cucumbers, spinach, tomatoes, carrots, lady's fingers, pea, wing beans, bitter gourd, snake gourd, ribbed gourd etc. Fill a quarter of the plate with starchy foods such as rice, bread, noodles, etc. Fill the rest with protein-rich foods such as meat, fish, eggs, soy, pulses etc. Let's examine in more detail the first portion of the food plate. That is non-starchy vegetables. Non-starchy vegetables are an important component of a diabetic diet because they are low in calories, having high fiber and low in glycemic index (GI). They help to reduce the rate of absorption of sugars and lipids in the diet and reduce the risk of certain chronic diseases. Selecting a variety of vegetables preferably in different colors, green, red, yellow, purple, gives a wide variety of nutrients including antioxidants and phytochemicals which have various health benefits. Diabetics can consume these non-starchy vegetables without any restriction. Let's look at the second portion, that is starchy foods or carbohydrates. Select foods with complex carbohydrates, which have plenty of fiber. Whole grain cereals are preferred to whole grain flour. Foods prepared from whole grain flours are better than foods of polished flour preparations. Rice should preferably be parboiled or minimally milled. Starchy vegetables and fruits, jackfruit, breadfruit, potatoes, sweet potatoes, manioc, corn, different types of yams, ash plantains, green peas etc., can be used in limited quantities in the second portion of the food plate. Korakin flour has a high GI, therefore, avoid overeating. The third portion of the food plate is protein-rich, healthy foods. Patients with diabetes have the same protein requirement of normal people, that is about 1 gram of protein per kilogram of body weight per day. Proteins from plant sources such as pulses, legumes, grams, cowpea, chickpea, dal, soya etc. are healthier in diabetes as animal proteins deliver more stress on kidneys. Excess protein intake can increase the likelihood of developing diabetic nephropathy, hence, it is important to adhere to the portion size shown in the food plate. So, that's the first rule, follow the food plate method. The second rule is that when selecting food items, select healthy choices. Healthy choices are, fish, a good source of omega-3 fatty acids and unsaturated fats. Nuts, cashew nuts, peanuts, pumpkin seeds and gingerly. Unsaturated oils such as gingerly, sunflower, olive, canola and soya oils are preferable for cooking. Skinless poultry is a safer option. 2 to 3 eggs for a week can be consumed. Eggs without the yolk is advisable for people with high risk of atherosclerotic heart disease. Milk products such as non-fat or low-fat milk, non-fat yogurt, and curd can be used. The third rule is on fruits. Fruits play a significant role in diabetic diet as fruits contain plenty of fibers and nutrients including vitamins, minerals, antioxidants and phytochemicals. Diabetics may consume 2 to 3 portions of fruits every day. When you eat fruits with low glycemic index, GI, such as avocado, guava, orange apple etc., sugar enters the body slowly and diabetics can be allowed to eat fair amount of such fruits. Portion size should be reduced when consuming fruits with medium to high GI such as mangoes, papaya, raisins, dates, watermelons, pineapples etc. Fresh fruits are preferable to fruit juices as fruit juices give rise to sudden rise of blood sugar. Preserved fruit juice, dried fruits and canned fruits which may have added sugar are best avoided. Spreading the consumption of fruits throughout the day will avoid sudden increase in blood sugar levels. The fourth rule is on restricted foods. What foods to be restricted? Fats. Patients with diabetes are at a higher risk for coronary heart disease and other vascular diseases. Therefore, fats and oils should be restricted and further limited by those who are overweight. Choose only non-fat or low-fat dairy products. Limit consumption of deep-fried foods, as they contain more hidden oils and trans fat. Though coconut oil is a saturated oil, it mainly consists of small-chain and medium-chain fatty acids which tend to get easily burnt for energy. Therefore, coconut oil can be consumed in moderation. Salt. While salt doesn't directly affect blood sugar levels, excessive sodium intake can raise blood pressure, which is a significant concern for people with diabetes due to the increased risk of heart disease, stroke, and kidney disease. Therefore, keep the salt intake below 1,500 mg of sodium per day, which corresponds to 3/4 teaspoon of salt. The fifth rule is what foods to avoid. Refined sugars such as table sugar, jaggery, treacle etc. Sweets, chocolates, cakes and biscuits. Sweetened drinks, fizzy drinks, cola drinks, energy drinks etc. shall be avoided as they can give rise a sudden increase of blood glucose levels, as well as excess energy intake could lead to overweight and obesity. Then, foods containing trans fat such as margarine, biscuits, fried foods etc. Pastries and various bakery products shall also to be avoided. Tea is acceptable without sugar. The sixth rule is about the amount and spacing of meals. Diabetics can include carbohydrates in every meal, but large quantities of even low GI foods can deliver a large amount of glucose. Considering this fact, diabetics need to spread smaller meals evenly throughout the day as even distribution helps to prevent fluctuations of blood glucose levels. The seventh or the last rule for diabetic diet is the recommended cooking methods. Remember to remove visible fat from meats and skin from chicken before cooking. Limit butter, cheese and other saturated fats. Use low-fat or fat-free cooking methods such as boiling, steaming, broiling, baking, roasting, grilling, steaming, and best as salads. Using non-stick pans and cooking sprays could help minimizing the amount of oil. As coconut oil delivers a minimal amount of trans fats, it can be used for deep frying purposes. However, amount of deep frying foods should be strictly limited to reduce total fat intake. That's about diet and diabetes. Now let's move on to hypertension or high blood pressure. Let's look at the harm hypertension does and why it should be controlled. Unhealthy lifestyle, imbalanced eating habits significantly contribute to high blood pressure levels or hypertension. Hypertension is one of the main risk factors for coronary heart disease, heart attacks, renal diseases, and the greatest risk factor for strokes. Hence, dietary modifications in hypertension are targeted to decrease the dietary factors that cause hypertension and its complications. For patients with hypertension, whole grains are a healthier option than refined grains, as refined grains contribute to raising fat levels in the blood. Vegetarian proteins like pulses and legumes are preferable for hypertensive patients as they contain high amount of fiber with no cholesterol or saturated fats. Modest amount of lean meats and fish can be consumed. It is best to limit meat intake as it contains unhealthy saturated fat. Fish is a good source of protein for hypertensives as fish contains healthy fats including omega-3 fatty acids. Milk, patients may consume 1 to 2 servings of low-fat milk a day. Not to be overlooked is the fact that the vegetarian diet is known to be associated with low blood pressure. Fruits and vegetables. They are naturally low in fat, high in potassium, magnesium, calcium, and fiber. Potassium is particularly beneficial for lowering blood pressure. Dietary fats from sources such as cashews, peanuts, avocados, pumpkin seeds, fish, etc. are considered as healthy fats. Now let's look at the foods that are restricted to patients with hypertension. High in the list is sodium or salt. There is a proven positive relationship between salt intake and high blood pressure. Recommended salt intake per person per day is below 5 grams, that is less than 1 teaspoon for a normal person, which equals 2,300 milligrams sodium, whereas for a hypertensive patient, this amount is further reduced to 2/3 of a teaspoon, that is about 1,500 milligrams of sodium. Patients should avoid regular use of foods containing high salt, chips, Marmite, dried fish, etc. There are other sources of sodium, other than salt, such as monosodium glutamate, MSG, which are added to food to enhance flavor and need to be considered in determining sodium intake. Secondly, fats. Excess fat intake is associated with high blood pressure. Animal fats and trans fats should be avoided completely. Trans fat is commonly found in processed foods, fried foods, and commercially baked items which are prepared using unsaturated oils. Then sugar. Refined sugar and sugar-containing sweets or beverages shall be restricted as they can lead to weight gain. Finally, in the restricted list is alcohol. Regular heavy alcohol consumption is associated with high blood pressure. If total abstinence is not realistic, alcohol consumption should strictly be limited as follows. Men may consume no more than 2 drinks per day and women should consume no more than 1 drink per day. A drink is defined as 1 glass, 240 milliliters, of beer or 100 milliliters of wine or 25 milliliters of spirits. So, if the dietary guidance for hypertensives is summarized, the ideal diet plan to manage blood pressure is a diet rich in fruits, vegetables, and low-fat dairy products, high in fiber, potassium, calcium, and magnesium, and moderate in protein. Hypertensive patients too need a well-balanced diet with cereals, fish, meat, eggs and pulses, milk and milk products, fruits and vegetables, and nuts and seeds. That is about hypertension. Now we will look at the recommended diet in coronary heart disease. Let's first see how this illness develops. Coronary heart disease is caused by the narrowing or blockage of the arteries that provide oxygen and nutrients to the heart. The process is called atherosclerosis, which is the gradual buildup of fatty materials in the inner linings of the arteries. This narrowing reduces the blood supply to the heart, causing heart disease. Coronary heart disease is the leading cause of death globally. Dietary modifications in CHD are targeted to reduce the risk posed by diet-related factors that cause CHD and its complications. These are the modifiable risk factors of atherosclerosis and coronary heart disease. So by modifying these risk factors you can prevent the illness or its complications. They are, high intake of saturated fat, high levels of low-density lipoprotein, LDL cholesterol, low levels of high-density lipoprotein, HDL cholesterol, obesity, that is BMI greater than 30, hypertension, presence of diabetes mellitus, smoking and alcohol, and stress. On the other hand, the protective factors against coronary heart disease are, healthy diet, regular physical activity, managing body weight, quitting smoking and restricting alcohol, maintaining healthy blood pressure and sugar levels, and managing stress. So you will see how diverse factors affect the causation and outcome of the disease. Hence, multifactorial risk assessment and management is the best approach for reducing the risk of coronary heart disease, as correcting one risk factor alone may have little impact. Here is a general dietary guidance or a description of a heart-healthy diet. To get the most out of the treatment and to avoid complications, patients with CHD should cut back on the saturated fats in the diet, as they promote atherosclerosis. Add unsaturated fats to your diet to help avoid atherosclerosis. Limit your consumption of refined sugars as they raise blood triglyceride levels, which promote atherosclerosis. Restrict foods that contain trans fats as they raise unhealthy cholesterol levels in the blood. Make use of plenty of heart-healthy foods that can help prevent heart disease. Let's look at how these 5 action points could be accomplished without compromising the requirement for protein, energy, and other essential nutrients. Meeting the energy needs from carbohydrates. As complex carbohydrates with an abundance of fiber provide definite health benefits, whole grains and foods prepared using them are preferable for patients with CHD. Thus, the best dishes for them are those made with red rice, parboiled rice, whole wheat flour, whole grain bread, legumes, karakan, oats, etc. Energy from fatty foods. Despite being a food high in energy, fats should be used cautiously, as some of them promote atherosclerosis. Reducing total fat and saturated fat, animal fat, helps prevent CHD and its complications. Limit eating foods with saturated fat, such as butter, cheese, whole milk and whole milk products, meat fat, hydrogenated margarines, lard, bacon, and palm oil. Avocado, cashew, peanuts, pumpkin seeds, nuts, olive oil, and canola oil are good sources of healthy fat. Despite being saturated, coconut oil's chemical makeup primarily consists of medium and short-chain fatty acids, which are readily burned to provide energy. Therefore, grated coconut milk and oil can be used in modest amounts. As much as possible, avoid fried foods, pies, rolls, pastries, patties, and other bakery products with high fat content as they contain high amounts of trans fats. Rules for meeting the protein requirement of a CHD patient are: select protein-rich foods with minimum fat content. If fat is present, it is ideal to have heart-healthy, unsaturated or omega-3 fat. Such foods are plant-based sources of protein such as legumes, nuts, seeds, tofu, soy, and so on. These sources also contain small amount of fat, which is healthy fat. Fish, in addition to providing high amounts of heart-healthy omega-3 fatty acids, fish helps lower triglyceride levels, which prevents blood clots from forming in the coronary arteries. Poultry is rich in protein but use them without the fat and skin. Dairy, low or non-fat products are the best. Eggs provide high-quality protein, but only one a day is recommended. Fruits and vegetables play an important role in preventing CHD and its complications. Fruits and vegetables including legumes, cereals, pulses and whole grains are rich sources of dietary fiber, which helps to reduce the rate of absorption of fat. Vegetables and whole grains contain high levels of antioxidants and phytochemicals, which will prevent the buildup of atheroma. Eating fruits and vegetables daily in adequate amounts will help reduce the risk of heart disease. Most of the fruits and vegetables are rich in potassium, and they contribute to a reduction in blood pressure. Therefore, Including fruits and vegetables in the daily diet will help reduce the risk of heart disease and its complications. Coming to dietary restrictions in coronary heart disease. Firstly, salt or sodium. Reduction in sodium decreases blood pressure, which lowers the risk of coronary heart disease. Hence, patients with CHD should limit the salt intake to 1,500 mg of sodium, 1/2 to 2/3 teaspoon of salt, per day. Patients should limit processed food, dried fish, salty confectionaries and biscuits as most of them contain high levels of salt. Sugar. Limit intake of sugar and foods containing refined sugar. Cut down on sugary biscuits, beverages and foods with added sugars, such as soft drinks, sweets, candy, cakes, biscuits, cookies, artificial fruit drinks, ice cream, sweetened milk and yogurt as well as honey and jaggery. The following should be completely avoided. Alcohol. Although moderate alcohol use is known to lower the incidence of heart disease, consumption of alcohol is not advisable due to various other adverse health effects associated with alcohol. Moderate alcohol use means 1 drink per day for women and 2 drinks per day for men. A drink is 100 milliliters of wine or 240 milliliters of natural strength beer, or 25 milliliters of spirits. Foods with unhealthy fats. Limit red meat and processed meats such as sausages, bacon etc. which are high in saturated fat and sodium. Margarines should not be used for cooking food as heating of margarines may generate trans fats which positively relate to the risk of CHD. Some eateries use animal fats and low-quality oils to make fried rice, katu and other fried foods. Hence such foods should be avoided at all costs. Trans fats are formed by heating unsaturated oils. Therefore, deep-fried foods such as fries, chips, cutlets, rolls should be avoided. That's about coronary heart disease. Next, we will look at the diet in dyslipidemia, or commonly known as high cholesterol. We will first look at the true nature of this problem. Fats that circulate in the blood are called lipids. There are 2 types of lipids in the blood. They are triglycerides and cholesterol. Cholesterol is of 2 types. HDL or high-density lipoprotein and LDL or low-density lipoprotein. All these lipids have important functions in the body, but in excess, they are harmful, except HDL. HDL is also called good cholesterol as it prevents atherosclerosis. LDL is referred to as bad cholesterol as it promotes atherosclerosis. Adverse health effects can also result from elevated triglyceride levels. What we expect is to have healthy levels of LDL, HDL, and triglycerides. That is, low levels of triglycerides and LDL and high levels of HDL in the blood. When it is not so, we call it dyslipidemia. Dyslipidemia carries a high risk of cardiovascular diseases, notably heart attacks and strokes. Dietary modifications recommended here are to support the body in maintaining healthy levels of lipids in blood so that the risk of cardiovascular diseases is minimized. Let's look at those dietary modifications. 3 major dietary factors contribute to high levels of bad cholesterol and triglycerides in the blood. They are, high intake of saturated fat and trans fats, high intake of dietary cholesterol and an imbalance of calorie intake and physical activity levels, leading to obesity. Therefore, it is necessary to switch from these unhealthy eating habits to healthier ones to prevent and control dyslipidemia and its complications. So the healthy dietary options that help to maintain a healthy balance of fats are cereals, grain, corn, sesame, soy, sunflower seeds and oil, and soybeans are all good sources of polyunsaturated fatty acids, which can lower cholesterol levels in blood. Fish, salmon, sardines, and tuna are the best sources of omega-3 fatty acids, which help lower triglycerides and hence have a negative effect on atheroma formation. Dietary fibers. Dietary fibers help lower LDL cholesterol by interfering with the absorption of dietary cholesterol. Sources of soluble fiber include legumes, grains, fruits like avocado, guava, mango, apples, oranges, banana, etc. Vegetables, pulses, cowpeas, gram, lentils, and various nuts are also good sources of fiber. In addition to providing fiber, fruits, vegetables, and nuts have various healthy constituents which have been shown to prevent atherosclerosis. Monounsaturated fatty acids in fruits and nuts are known to lower LDL cholesterol. Avocado, sesame, cashew nuts, peanuts, canola, and olive oils are good sources of monounsaturated fats. Plant sterols help to block the absorption of cholesterol from the gut. Sterols are present naturally in many fruits, vegetables, nuts, seeds, cereals, legumes, vegetable oils, and other plant sources, including wheat, corn, and soy. Milk. Non-fat dairy will help reduce dietary intake of cholesterol. Then, there are several dietary restrictions that patients with dyslipidemia should be aware of. They are, saturated fat. Saturated fats increase serum cholesterol and triglycerides. Cut down on foods high in saturated fats, such as meat fat, especially pork, beef and sausages, poultry fat, high-fat dairy products, including cheese, butter, ice cream, whole milk, palm oil, deep-fried foods, fried snacks and fried rice. Dietary cholesterol. Dietary cholesterol increases blood cholesterol. Sources of dietary cholesterol are meat, organ meat, egg yolk, and full-fat dairy products such as cheese, ice cream, and milk. Restricting portion sizes of these foods and switching from full-fat dairy to non-fat dairy will help reduce dietary intake of cholesterol. Another important dietary restriction is trans fatty acids. Trans fatty acids are produced during a process known as partial hydrogenation, which solidifies vegetable oils in the production of margarine and fat spreads. It is also found in fried foods. Trans fats have negative health impacts, such as lowering good cholesterol, HDL, and raising bad cholesterol, LDL, levels in the blood. Thus, it is best to avoid foods that contain trans fats, like margarine, fat spread, savory snacks, cakes, cookies, pies, and fried foods. Salt in excess amounts may cause fluid retention and hypertension. Hypertension combined with dyslipidemia may promote complications of both. Hence, patients should limit salt intake to the recommended amount, that is, less than 5 grams, 1 teaspoon, per day. Alcohol. Alcohol has a strong linear association with serum triglycerides, and most patients using alcohol have high triglyceride levels, which promote atherosclerosis. Hence, alcohol should be avoided, especially by individuals with high triglyceride levels in blood. The fifth and last disease we look at is cancer, and what's the importance of diet in cancer? Let's first understand what the disease is. Cancer is an abnormal and uncontrolled growth of a body tissue. It is the second leading cause of death globally. Nutritional interventions and assistance are required for problems caused by cancer or its treatments, such as surgery, chemotherapy, or radiation therapy. The nutritional interventions and support in patients with cancer are intended to improve their ability to fight the illness, boost the immune system, assist in keeping energy levels and weight within a healthy range, sustain appetite, and aid in treatment tolerance. As a general guidance on diet, patients with cancer should make the change to a healthier diet from an unhealthy one. To be specific, they must focus on plant-based foods like fruits, vegetables, whole grains, legumes, nuts, and seeds. As protein sources, use plant-based proteins. Beans, lentils, soy, are better options. Among animal sources, use lean meat such as chicken, fish, and turkey. Among fats, choose healthy fats such as olive oil, avocados, and nuts. More importantly, patients should avoid processed foods, sugary drinks, and alcohol, as these can negatively impact overall health and hinder cancer treatment. Now let's look at dietary support needed in specific conditions associated with cancer and its treatment. A common condition we encounter with cancer is loss of appetite. The cancer or some treatment options can cause a loss of appetite. The following measures will help improve the situation. Rather than 3 large meals, eating small meals and snacks throughout the day will help. Consuming calorie-dense foods like nuts, seeds, cheese, oils, etc. will give the required quantity of calories from a small quantity of food. Drinking most of the fluids between meals, not during meals, helps ensure adequate consumption of meals. Eat foods that are appealing to the sick. Broth, toast, rice porridge or congee, raisin, etc. Blending the food changes the texture of the food and may improve acceptance. Try new recipes, which will improve acceptance. If the condition allows, physical activity like walking will help increase the appetite. Secondly, constipation may be related to the disease, its treatment or dietary habits. To overcome the situation, drink plenty of water. Increase your intake of fruits and vegetables. Some fruits and vegetables have a laxative effect that works well. Commercially available fiber supplements are a convenient option, but they must be recommended by the treating physician. Diarrhea is sometimes observed with some treatment options. To help in this situation, drink plenty of fluids, choose foods or drinks with sodium, kangi, and potassium, but limit milk. Rice kangi made of roasted rice and bread toast can help. Oral rehydration solution is the best in replacing lost fluids. Consider probiotics. These may help restore a healthy microbial balance in the gut, but the treating physician must recommend them. Avoid carbonated drinks and alcohol, these can worsen diarrhea and dehydration. One other problem is nausea and vomiting that commonly occur in cancer patients during treatment. The following measures will aid in the improvement of symptoms. Ginger helps in nausea. Chewing on a small piece of ginger will help relieve nausea. Avoid eating and drinking for an hour or two after the last episode of vomiting. Start with small amounts of clear liquids, such as water, lime juice, or king coconut water. Slowly start solid foods with rice kangi, toasted bread, or crackers. Avoid alcohol, spicy foods, salad, raw vegetables, milk and milk products, and fried foods for a day or two. Weight loss is also a common problem among patients with cancer. In order to address weight loss, promote healing, maintain energy levels, and handle many challenges that may arise during treatment, patients should consume a diverse range of foods that are high in calories and protein, such as milk, butter, and cheese, cooked eggs, lean proteins and healthy fats and oils. Some of the best foods to eat during chemotherapy or other cancer treatments are plant-based proteins such as vegetables as well as beans, legumes, nuts and seeds. They offer the highest levels of natural vitamins and minerals. Proper function of the immune system plays a crucial role in the causation and recovery of patients with cancer. Therefore, dietary support to enhance the immune system is of paramount importance. A balanced diet, rich in fruits, vegetables, and whole grains, is recommended to provide the body with essential nutrients and support the immune function. Naturally occurring vitamins and minerals in these foods help our body's enzymatic processes, which play a big role in boosting immune function, reducing inflammation, and fighting off cancer. Avocados, olive oil, grapeseed oil, and walnuts all have monounsaturated and polyunsaturated fats and omega-3 fatty acids, which support the function of immune cells. What foods should be avoided during cancer treatment? During cancer therapy, pay close attention to the patient's diet because certain foods may have a negative impact on treatment. It's best not to consume highly refined, processed foods and fried foods as they contain a lot of hydrogenated oils, which can increase inflammation. Alcohol should be avoided since it can interact with some medications, intensify their side effects, and may also interfere with the body's ability to recover. Patients and caregivers should pay attention to the safety of food as the immune system can be weakened by certain cancer therapies. As a result, the patient's ability to fight against infections is weakened. Therefore, to safeguard food from pathogens, extra caution and hygiene are required during food preparation and storage. Wash raw vegetables and fruits thoroughly, and be careful to use separate utensils, plates, and cutting boards when preparing meats and produce. Food should be stored at proper temperatures. Consider avoiding foods that carry the risk of foodborne illnesses, such as lightly cooked or raw fish, sushi, soft-cooked eggs or foods that contain raw eggs. Coming to dietary supplements. Dietary supplements may be useful if the patient cannot eat enough. Sometimes, despite the best efforts, the patient may not be able to eat enough due to many reasons, including severe side effects of treatment. The decision to recommend commercially available food supplements has to be taken by the treating physician or the nutritionist. If the patient cannot eat at all, there will be a need for specific feeding techniques. In cases when the patient cannot eat at all due to specific medical issues, there are two types of nutrition support available. They are enteral, food given through a feeding tube, and parenteral nutrition, given directly into the blood. The treating physician and the nutritionist will decide on these special interventions. A final note on personalized care. The dietary interventions we discussed under diabetes mellitus, hypertension, coronary heart disease, dyslipidemia, and cancer will not only assist in the prevention and treatment of these diseases but also help to prevent complications. Please note that the dietary recommendations given here are general and based on accepted guidelines. Situations widely vary between patients, especially when they have multiple disease conditions. The healthcare professional will offer the best personalized advice. This brings us to the end of our discussion on dietary interventions in 5 of the most common chronic diseases. Here are some more videos about human nutrition available through this channel. If you find these videos helpful, you can subscribe and click the bell icon to receive notifications when new videos on various topics are posted on this channel. Thank you.